After performing lead tests, we can now go into the memories of the device and see what it has registered. In the summary screen, we can observe heart rate, ventricular pacing percentage, episodes of VTVF or atrial fibrillation burden. This is of course one of the most important screens during CRT interrogation. In the next screen, we can observe the heart rate curves of the previous few days. Very useful to see whether the patient has shown any signs of chronic incompetence. It's important to realize that these are atrial frequencies. In the auto sensing tab, we can see that there are no signs of R waves under sensing, neither are there signs of R wave over sensing, as there is only a single event sensed in the VF zone. Similarly, for the atrial lead, there are no signs of atrial undersensing, as all the P waves are sensed far away from the programmed sensitivity. This is very important because atrial undersensing is a common factor for loss of CRT. Also, there is no signs of P wave oversensing because there are no P waves sensed in the mode switch zone. Then the next section holds a lot of useful information, but one of the most important screens is the chronological follow-up. And here we can see how much biventricular pacing has been going on the last few weeks or even days. Here everything is looking good, but we'll show you plenty of examples later in the course. In ICDs, it's also always recommended to go into details and then all the way to the bottom to see whether there are short cycles on the RV lead, which may indicate lead noise and lead dysfunction. We can appreciate that the coil continuity trend has been stable, no arrhythmias, and that the sonar CRT optimization has been actively changing AV and VV intervals. Here we can confirm that the sonar CRT optimization algorithm has indeed been activated. While DDD and DDDR modes are most often programmed in CRT patients, it is also possible to program SAFER mode, for example in patients in whom CRT is no longer necessary. Of course, we can also program basic rate and the maximal tracking rate, which in CRT patients is very important, as failure to track during high atrial rates, as for example during exercise, is a common cause of loss of CRT. The features in the Brady screen have been discussed in the pacemaker course. There is only the sonar CRT optimization rate which is programmable. If we then go to the Tachy tab, we can see all the features which we have discussed also in the ICD course. But an important feature in CRT devices is the capability of performing ATP using both the right and the left ventricular lead. In the final screen, we can see that there are customizable alerts for LV lead impedances.